Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am speaking with Julie Genzel, Director of Primary Care at Centretown Community Health Centre in Ottawa, Ontario. Centretown Community Health Centre is a non-profit, multi-service community health centre that has been playing an active role in the community since 1969. They offer a full range of community services delivered by a diverse team of professionals, including doctors, nurses, social workers, counselors, dietitians, community developers, health promoters, and outreach workers. How are you doing today, Julie?
I'm great. Thanks, Hilary. How are you?
Wonderful, wonderful. So we've already had the lovely opportunity of speaking with the executive director of Centretown in another episode, which I encourage everybody to go listen to. But for anyone who had not heard of Centretown before or needs a bit of a refresher, could you briefly tell us about your organization, location, services and programs provided, and the population that you serve?
Sounds good. I think you did a great job in your introduction. We're a CHC in downtown Ottawa, and we have a diverse range of services. So we have primary care with a rostered clientele, as well as lots of specialty programs from obstetrics, the trans health program. We've got a program focused on our street-involved folks as well. We also have a regional diabetes program. We have mental health and addictions programming and early years and early on. So we cover across the lifespan and across the populations.
Amazing. Perfect. Over the last 3 years, the COVID-19 pandemic has presented unforeseen challenges in all sectors, and the vulnerable population has been one of the hardest hit groups, as we both know. What has been the impact of the COVID-19 pandemic in your specific community, and how have you been able to address it? And how has Centretown been navigating providing care and services to your clients during this very difficult time?
I think the pandemic has really highlighted the health disparities and the barriers that some of our most vulnerable folks face. And us as a CHC are really well equipped and well positioned to help those folks navigate the barriers and the increased burden that the pandemic placed on them. So we've been there throughout. We've had our doors open throughout and provided services. One of the challenges that we've definitely seen highlighted is that, we have seen a surge in need, and we haven't really had the funding and support to continue that in a sustainable way. So really hoping that this and sort of getting the word out about CHCs and the work that we've done through the pandemic continues to highlight how much we really contribute to supporting our most vulnerable populations.
Absolutely. And in terms of funding, Centretown was one of the recipients of the CVP-National PHAC funded project. Could you tell us a little bit about the specific project Centretown had and its goals, and include any activities or programs or resources that were created?
Yeah, so our CVP project was designed more so as an extension of the work that we were already doing. It allowed us to continue for an additional 6 months. And we had been providing and continued to provide COVID vaccine clinics on site in the community health center, both for our own clients as well as for the broader community. We did a lot of work through outreach to really get to the most vulnerable folks who weren't able to come into the center, or folks who felt like they didn't want to be out in a public setting when they received their immunizations. And then we were also able to take the time to integrate a process into our primary care clinic for ongoing vaccines.
That's great. Very, very lovely work. I get to hear a little bit about it behind the scenes in my work, and that's great. What milestones or achievements were you able to achieve through this, extension of the work that you were already doing? And were there any lessons learned specific in this project so far? Considering it was an extension, I guess, any lessons learned throughout dealing with the whole pandemic?
For sure. So we were able to administer over 400 vaccines between October and March, which is when we had the grant funding, it doesn't sound like a lot, but it is a lot when you're also reaching sort of the dwindling number of folks looking for vaccines at that point. And among those vaccines, we were actually able to give some first and second doses as well. So that was a big highlight, that we managed to reach those who had waited until then, but for whatever reason, were then ready to get their shots.
Awesome. And have you and your team experienced any challenges or barriers to the vaccine promotion and uptake in your community? Because as you mentioned, those dwindling numbers, as I got here on my side as well. And how did you manage any of those challenges?
I think the biggest challenge was those dwindling numbers. By then we had COVID vaccine fatigue, we had COVID fatigue. We also had kind of already past that initial surge for the fall booster season. And so one of the ways that we ended up addressing it is making ourselves a one-stop shop as a safe place for folks to come in and get their injections for both COVID as well as the flu. And so we really promoted it as an all-around effort to try and reduce the illness burden in our community.
And did your project involve any partnerships or collaborations or any relationships that you were able to use to leverage and ensure the delivery of your project?
Nothing specific for that. I mean, we certainly worked with all of our community partners, whether they're the shelters, whether it's our outreach partners, to continue doing the work that we were doing, but no specific partners for this program.
Amazing. With new variants and the approval of booster doses, what effect had those had on the work that your center carried out, as well as the CVP-National project? And in other words, how have you been adapting to the ongoing health issue now that we're, past that 3-year mark, which is insane to say?
It's been a long time for sure. So I think the grant gave us that flexibility to carve out the time for COVID lead nurse, who we no longer had the funding to specifically keep in that position, but we really wanted to make sure that we were still able to keep up to date with treatment updates, with vaccine updates, with making sure that if there were any surges, we were ready to respond. And so we used part of the funding from the grant to carve out that time where they were able to, one, create the process of better integrating vaccines into our primary care delivery and making sure that that was smooth and time efficient, and that we were wasting as little as possible in an ongoing way. And then also that they were able to continue keeping the team up to date on all the updates that were relevant.
And I know you mentioned those, I think you said 400 people that were the doses that were able to be administered during the time of the project, but how, and if there's any other ways, how has the funding through the CVP-National project helped your center and the community it serves in any other ways?
I think it's most specifically in that, right? Continuing to be able to get the word out about the COVID vaccines, and just in general being able to answer questions about COVID or COVID vaccines or COVID treatments, and having the time to do that and the resources available to do that.
Perfect. And what are the next steps for Centretown Community Health Centre after the CVP project in regards to COVID-19 and your hope for the future, other than, this pandemic feeling like it's finally over?
That would be great.
Yeah.
I think the main outcome is going to be that our person who is in that COVID lead role is still able to kind of keep a side eye on updates and share that with the team. But we've got a system in place. Should there be a surge, we've got our processes and everything written down. We've got the expertise built in our team to respond quickly if there is a surge in need or in demand. And having that extra time allowed us to really build up that capacity.
Amazing. I mean, you mentioned before, the ability of community health centers during this time, and I'm curious, what do you think your experiences throughout the pandemic say about the ability of community health centers to adapt to emerging social and public health issues, and the importance of CHCs within our overall health and social service system?
I think as CHCs, as I said before, is we're well positioned because we're right on the front line of the need, right? So we hear from our clients what they're experiencing. We see the disparities, we see the need that's out there, and we have the wraparound services to address them. And so we're in a really great position to respond to those surges, and we have staff who are committed and are strong advocates for supporting folks who are otherwise often left on the sidelines during sort of a crisis situation. The challenge is the funding and the ongoing sustainability, right? Across the board, CHCs need to have that investment in creating sustainable programming and staffing that can respond to the increased demand, and that demand is surging, and the funding isn't surging in correspondence. So we really need to see that investment come forward.
Absolutely. We certainly, on this side, we could not agree more that, overall investment for all community health centers would be ideal and amazing work. Julie, I want to thank you so much for taking the time to speak with me today. If anyone else was curious to learn more about the work that Centretown Community Health Centre is doing over there in Ottawa, where would they go find that information?
We do have a website, so it's centretowncachc.org, Centretown with an RE in it. And we also have a Twitter and Instagram and other social media, and it's all linked there on the website, so they can head over there and take a look.
Wonderful. Awesome. Thank you so much.
Thank you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.